Before I hand over to Adrian and Philip, I'm going to give you a quick introduction to the Chamber and talk you through some of the support that we've been delivering for businesses at this time. So first up, Greater Birmingham Chambers of Commerce. Who are we and what do we do? Well, we're a not-for-profit business membership and business support organisation. We've actually been in business for business since 1813. So as a fun fact for you, we're actually older than the Statue of Liberty. But today's Chamber exists to connect, support and grow local businesses. We've got around 100 members of staff helping businesses with absolutely everything from marketing and finding customers locally to getting started and expanding their markets internationally, trading globally as well. Throughout this coronavirus pandemic, obviously a huge period of change, disruption for businesses, we've really been focusing on helping businesses connect their fellow businesses at this time, keep business moving, being able to continue to do business as far as they're able to through things like our GB Chamber chats, social media networking and member-to-member offers. We've also been helping businesses understand government policy, all of the frequent changes and announcements that are coming their way through daily updates in our Chamberlink daily newsletter, a whole coronavirus hub on our website, complete with lots of briefings, advice, guidance, best practice, and also information from Chamber members as well. And also lobbying on our members' behalf. That's particularly an area that my team spend a lot of time doing, finding out what isn't quite working for businesses, where the gaps in support are, where the concerns are about policy moving forwards, and lobbying stakeholders to deliver for what businesses need. And then finally, we're continuing to help businesses grow awareness of their organisations through providing blog posts, thought leadership content, and generally getting involved in Chamber activity. So there's plenty on the go. If you're interested in finding out more, do pop a comment in the chat box and Grace will be able to connect you up with my colleagues. So that's about it from me. I'm now going to hand over to what you're all really here for, to hear from Dr. Philip McCrea and Adrian Hope on how to create a COVID-secure workplace. So, Philip, over to you in the first instance.
Well, thank you very much, Henrietta, and good afternoon, everybody. We're living in very challenging times, and today myself and my colleague Adrian will be hopefully sharing some of our thoughts and experiences over the last few weeks of how we're helping customers deal with this unprecedented crisis that we're in. As the lockdown eases and the nation starts to consider how we get back to normal, everybody's talking about what this new normal is and what have we learnt from the last 11 weeks. The aim, of course, when we're getting back to work is to ensure that employees get back to work safely and they're kept safe in the workplace whilst being productive while organisations kickstart their businesses again. But there are some significant issues to be dealt with. I'll be touching on these later around the mental health aspects of the crisis, the lockdown and the return to work has produced. So how real is the paranoia surrounding COVID-19? Well, I would say to you, everybody, it's very real. I'm doing clinics, remote clinics by telephone or video consultation. I'm talking to a lot of people who are really, really worried about going back to work, about contracting the virus and bringing it back to their family. So I think we often talk about rational fears and irrational fears. In this scenario, it's a rational fear because the risk is significant and real. Having said that, there have been a lot of positives, I think, out of the pandemic. We've improved our use of communication, and travel doesn't seem to be as so important anymore. Running around the country, driving in cars for miles, getting on train journeys for hours to meet people just doesn't seem as important as it used to be. And interestingly, I was told yesterday that Twitter as an organisation, who employ around 4,000 people, have sent information to 2,500 staff yesterday, telling them never to return to the office, that they can work permanently from home. So these are major decisions that people are making. And possibly the balance of working from home and life, etc., has now become more important. Many organisations are considering what I call the 60-40 option, because we will be obliged in the new norm to have the measures of social distancing in place, which my colleague Adrian will discuss in some detail later. Organisations are looking at how we stagger return to work, and a 60-40 option where people work 3 days from home and 2 days in the office seems to be gathering significant momentum. It enables the social distancing scenario to be implemented. It results in less commuting. It's probably much more environmentally friendly. For example, I don't know if those of you in the news will have seen fish in Venice for the first time in many years. And I even believe you can see the tops of buildings in Beijing now, such as the level of diminished pollution. So there's almost a sensation developing in tandem with the paranoia that actually we may have a better way of working. And I think as a society, we probably view things a little bit negatively. The term that has crept that I hear all the time, and I think all of you will have heard, is the term social distancing. Now, that's fine, but that puts the emphasis on keeping a distance. I've often said to people, should we not be calling it distance socializing, which puts the emphasis on being sociable? That's just a thought for you. Anyway, looking at the strategies that we have been engaging in customers with over the last few weeks, how do we get employees back to work safely and effectively? What I'm going to do is concentrate very much on the human, the employee aspects, and Adrian, my colleague, will deal with the workplace when you actually get back into it. Okay, number of strategies to help. Temperature testing and questionnaire. This has been carried out by a lot of employers who are testing employees' temperature every day or every time they access a site. And obviously, those employees with a high temperature are being asked to go home. Well, there's a lot of pluses about that. It's very user-friendly, it's non-invasive, it's easy to do, and it's low cost. So there are a lot of positives. And of course, it will detect people with a high temperature that you can sort of send home and minimize the risk of anybody coming in with any infective process to the workplace. There are some negative aspects about this as a sole usage facility. First of all, it's very non-specific. You're using a very broad brush and will miss many people who are incubating the virus but do not have a high temperature, and indeed those who are asymptomatic. So it's not going to stop the spread of the virus, but it is a useful screening measure, and also I think offers a degree of reassurance to people that the employer is taking this seriously and doing things. One of the dilemmas I've faced from people who've expressed reservations about going back to work is the fact that there seems to be a gender gap or a gender disproportionate response. Certainly people under the age of 40 who have no comorbidities have a very low risk of contracting the virus and having significant ill health effects. This, to a certain extent, may have created a degree of complacency in the younger population. So, for example, I know of one of my customers who has engineered a return to work program in the last 2 weeks utilising social distancing measures. There have been concerns that their younger employees are simply not complying and have essentially returned to normal practices, which in turn is causing the older employees with whom they work alongside some degree of anxiety. So this is, I think, key factor to just be aware of when you implement your strategy. Diagnostic testing. The current test being rolled out across the NHS and in the various drive-through centres that you will have seen in the news tests for the presence of the antigen. In other words, it tests for the presence of the virus in your system. And it does this by virtue of a nasal and throat swab, which is sent to the laboratory. That essentially is 100% effective in diagnosing the virus if you actually have it at the time of the test, and the virus itself is in a process of what we call shedding. In other words, it's active. The difficulties of doing this test widespreadly is it's not as it's quite invasive, and you've got to take the swab from somebody's nose and throat. So it's very difficult to do yourself. You have to know what you're doing, because if you don't actually carry out the swab effectively, you'll miss the virus, and therefore the test will be false negative. And it's also quite expensive. You've got to send it to the laboratory, and current approximate individual costs are around £80 to £85 per test. You also have to wait sometimes 72 hours for the results. So there's a question of what do you do with this employee whom you've tested on site and you've got to wait 3 days for the result. Antibody testing is gathering a lot of momentum. There are a lot of employees who are keen to do antibody testing. And on the other side of the fence, there are a lot of concerns about the validity of antibody testing. The Public Health England have validated 2 antibody tests, one produced by Roche Laboratories in Switzerland and one by Abbott Laboratories in the States. There are concerns with both of these, and indeed the regulatory agency has asked for self or home testing using these antibody tests to cease while they do some further analysis. I think I probably know the reason for the concerns there. In both of these tests, you have to extract about 10 millilitres of blood to send to the laboratory for testing. And it is very difficult, if near impossible, to actually extract 10 mils of blood from a finger prick sample. So I think there have been difficulties at home with people trying to do this themselves for obvious reasons. I've spent about 6 weeks on various webinars, global calls and analyses, trying to find a solution for customers. And I think within the limitations that I face, I have probably found a solution that may be suitable for most employers. It's an antibody test which currently has what they call a 99.4% specificity. This compares favourably with the 2 Public Health England validated tests, which are 99.7 and 99.8 specific. I think a key point there is nothing is 100% accurate or specific. So I think we've got to be aware of the limitations. But why would I suggest we might use this antibody test? Well, first of all, it's a finger prick test which is done at near patient. In other words, it's done there and then beside the person having the test. So you don't need to send it to the laboratory, and you can have the results in 15 minutes. So it's quite speedy, it's quite user-friendly, and it's low cost, currently retailing around £30 per test. So I think the cost compares favourably with other antibody tests. So what does it do? Okay, you get 4 results when you do the antibody test. The first result is a negative test. And all that really can be interpreted as saying is that you do not appear to have been exposed to the virus. Now that test is only valid up to including the day you do the test. So we would recommend that people who test negative need to be regularly screened and tested. Currently, every 14 days. But these guidelines and pieces of advice are being updated as we learn more about this virus. The second outcome could well be a positive result. Now, if you get a positive result for what we call the M antibody, that suggests you've recently been exposed to the virus, and therefore the conclusion is you are both highly contagious and highly effective. So in other words, you have somebody who's got active evidence of COVID-19 in their system at the time of the test. What we would recommend in that case is that you proceed to do a swab test for confirmatory diagnostic tests, but you send these people home immediately in a controlled way to isolate for 14 days. The third possibility is that you get a test for both IgM and IgG antibodies. I should say, when you're exposed to any virus, and this happens in the flu illness every year, your body produces the M antibody first. I call it M for immediate, so it's an immediate response. And then as you develop an immunity to it, you produce the longer lasting antibodies, the G antibodies. And the G antibodies in previous viral epidemics have been used to measure your immunity to the virus. So if in this test you get an M and a G positive result, it suggests that you are at the later stages of an acute infection. The advice would still be the same: confirmatory diagnosis, send home in a controlled manner, isolate for 14 days. If the fourth result, which is a G antibody positive test only, then this indicates that at some point in the past, at least 14, but probably 21 days or greater, you have been exposed to the COVID virus and you have mounted an antibody response to that. Now, in normal circumstances, what we would say to individuals with that type of result is, you've had the virus, you may not have known about it, and you're now probably immune to it. So you're less likely to get a second episode and you're immune from it. Unfortunately, in this current virus, we don't know if that's true or not. Although we know the virus is COVID-19, its actual official name is SARS-CoV-2, because SARS-CoV-1 occurred in 2003. And in that outbreak, they found that people did not get a second infection or reinfection, and that they had the preservation of antibodies and immunity for around 36 months post-event. Whether that is replicated in this epidemic, we don't know. But I think at this point in time, measuring the antibodies gives you an indication of who is safe to come back to work, who is reassured about it, and who isn't. So it's a reassurance mechanism. Now, BHSF are currently in a position where we are able to provide all of these packages to customers who need them. I think what we ask all customers to do is carry out your risk assessment, evaluate your needs, and then we are here to support and help you. Because in addition to doing testing, there is a lot of concern and worry out there. So we do offer an advice line, which is available for customers to contact at any stage for guidance and advice on queries. And in addition to that, we also offer a COVID-19 telephone consultation service. These are for people, usually employees or patients, who have concerns about their own health or the health of their loved ones and want professional advice. So that is available to all of our customers, as is a formal occupational health assessment, which we're currently carrying out by video or telephone. And we are now looking at how we get our clinicians back into the clinics safely and effectively. So that's a sort of an official view or overview about testing, getting people back to work, and what it's supposed to do. It's designed to try and allow an employer to determine who is at most risk of infection, who is safe to come back to work, what happens if they have it, etc., etc. I would point out once again, there are limitations of all of the testing, that this will be updated as we go along and learn more. And also, it's a guide rather than a complete panacea. Important to note that Adrian, who will talk about measures, I was speaking to an orthopedic surgical colleague of mine who reminded me on Saturday that 35 years ago, he carried out an investigation, a survey in open orthopedic surgery, where 100 patients were operated on by a surgeon who wore no mask, and 100 patients were operated on by a surgeon who wore a mask. And they compared post-operative infection rates, which were identical. And they formed the conclusion 35 years ago that the wearing of a surgical mask had no benefit in reducing the risk of spread of infection. I think that's just a key point, because we're increasingly being asked to wear face coverings and masks. I think just people need to be aware of the limitations of these. I would also like to comment that recent evidence from the States, which I was informed of last week, has suggested that while the virus can live viably, viably for 72 hours on surfaces, there is no evidence whatsoever that anybody has contracted this virus from spread from a contaminated surface. At this stage, we believe strongly that this is a human-to-human transmission generated by aerosol, by water droplets, and not by handling surfaces. I think that's an interesting piece of new information. I said at the start of this, we were going to talk about mental health. I joined a World Health Organization webinar in April, attended by 900 delegates, which expressed concerns that the lockdown across the world in various countries would precipitate significant levels of mental health deterioration. I think we are starting to see aspects of that. I'd like to mention 2 patients that I've actually assessed personally in the last 2 weeks. One who has struggled to cope with the restrictions in lockdown, the social isolation, the inability to socialise, the inability to spend time with friends and family, and who has suffered a significant mental health deterioration. That gentleman is aged 21, and when I was assessing him last week, he was actually suicidal because of the restrictions, the impact on his mental health. We had to implement a crisis response measure for that young man. But interesting, he was unable to cope with the impact of the lockdown on his mental health. Conversely, I also had a conversation with a gentleman last week in his 50s, whose job involves him going into care homes to repair equipment or to install new equipment. And he has been off work for 8 weeks because he is simply too anxious to go back to work, because he is worried about contracting the virus and bringing it home to his family. So such is the level of his anxiety surrounding going back to work that he's now been off work 8 weeks and simply cannot foresee a return to work under any circumstances. To be fair to his employer, who's very supportive, they don't have another job for him. So if he can't go back to work and actually go into care homes and carry out the necessary maintenance and installation, they cannot employ him. They've offered him all the standard PPE, they've offered to assist in any way, but he simply is too anxious to go back to work. So this gentleman runs the very real risk of losing his employment because of the fear of contracting the virus. And thirdly, many employees have been furloughed under the government's job retention scheme. Whilst that's been an admirable scheme, and whilst that has helped keep people in employment, I speak to a lot of employees who have developed what they call furlough fear. In other words, the fear that there isn't a job to go back to, that they were selected because they weren't needed, or they were selected because they are in some way inferior to their colleagues who've been retained, and have developed anxieties surrounding that. So ironically, many employers were very positive in furloughing employees because they had dependence or childcare issues or other factors which made it more sensible to let them work from home. That's almost become an issue in itself to deal with. So you can see the complexities that employers face in getting people back to work. And thankfully, our newly launched RISE programme, which offers a sort of 360-degree mental health support programme, both through access to medical specialists who can deal with mental health, but also for pragmatic guidance and advice on debt management, on dealing with care needs and working at the same time, dealing with sort of other personal health issues. We have a very good service that is open to employers to use. So I think that's my overview of returning to work, the complexities we face. I'd like now my colleague Adrian Hope to talk to you about the measures in the workplace that employers can put in place.
Thank you, Phil. While Adrian gets his mic back up and running, just want to thank you for the useful guidance around looking at staggered returns to work, the importance of testing. You mentioned the finger prick test. I wondered if you had any information on where employers who might be interested in that could find out more about it.
Well, yes, Henry, we're happy to take, we hope to be launching a national antibody testing programme either week commencing 15th of June or week commencing the 22nd of June. So we're very happy to provide guidance and advice on what we're planning to do. BHSF, Henrietta, as you know, is a not-for-profit organisation. So our aspiration is to provide quality services that are value for money and that are ethical. So that would have our seal of approval if that is reasonable.
Fantastic. And picking up on the points around mental health as well, that's something we hear raised quite frequently. And I think the Chamber ourselves have actually trialled the BHSF RISE programme and found it really effective for that wraparound support for people who may be experiencing all sorts as a result of this really unprecedented situation. Right, I can see Adrian is up and running. So Adrian, over to you.
Hi, good afternoon, everyone. I'm hoping you can all hear and see me. We had a few technical issues earlier, but I can see myself on the screen, so hopefully all will be well. So I'm the Chief Corporate Services Officer at BHSF, and amongst my responsibilities include facilities and health and safety. You can probably tell this isn't my home. I'm in the office today. We have a duty director on site, and it's my turn today. And I look after the building and the health and safety function. Really want to focus on two things today. Firstly, on how we've been able to support Phil and our operational teams in being able to allow them to return to work, and also to give you a flavour of the official guidance from the likes of BAYS, the HSC, ACAS, and so forth. I'll try and keep that fairly brief because it's all stuff you can find out for yourself on the internet, but I thought it might be useful by way of context. As a disclaimer, I'm not a health and safety expert, I'm not a lawyer, and I'm certainly not a clinician, so the general guidance is go and do your own research. There's tons of stuff out there on the official websites. I would also refer you to the Chamber support page. There's really good webinars on there. I think there was a guy from the Health and Safety Executive. It was the Chairman, Martin Temple, on the 30th of April. Also the other business organisation support pages, and as well your own trade associations. So I'll just run through quickly the general guidance. So one thing to bear in mind is that health and safety law and equality law still very much applies. There's no dispensation during coronavirus for not doing things in the right way. And I'm sure you all know this, but there's a statutory duty to ensure, so far as is reasonably practicable, the health and safety at work for employees and employers. And that's about setting up and implementing a safe system of work. There's a similar obligation in common law as well. One of the interesting dimensions of this is health and safety law is intended to address health and safety risks addressed in the workplace or arising from the work itself. This is a public health emergency, so effectively we're using health and safety at work measures to address public health emergency. I'm sure you've all seen the government guidance, but there's been a recent change in emphasis around those people who can't do their work from home being actively encouraged to come into work, except where the workplace is closed, so restaurants and so forth, and that employers should make sure that their workplace environments are adapted to make them COVID secure. As far as I'm aware, there isn't an official government guidance of what constitutes COVID secure, but there is some sector-specific guidance that I'll refer to shortly. And the general approach from the HSE is that every business is different, every business has its own challenges and its own circumstances, so they can't be specific, but what they can do is give you general guidance for you to apply in your own context. Broadly speaking, and the page I would absolutely refer you to if you haven't seen it already is on the gov.uk website, so it's gov.uk/working safely, and you'll find all of the stuff on there, and I'm sure the Chamber will issue useful links afterwards as well. So there's 5 steps that the HSE set out to working safely, and the first is to carry out a COVID-19 risk assessment. I'll come back to that. Then developing cleaning, hand washing and hygiene procedures, helping people work from home, maintaining a 2-metre social distance, and where people can't be 2 metres apart, manage the transition risk. So the expectation is that employers will design out that risk, and from that perspective, so the sort of thing would be making sure people aren't working facing each other and so forth. Redesigning your working processes is really important. So the key thing from the HSE is home working as a first protection, then social distancing and cleaning and sanitisation. PPE, actually, they're not really focusing on that. If your work requires you to have PPE, so if you're working in a dusty environment and you need PPE or RPE, you should continue to do so, but there is no real requirement apart from in specific clinical settings for PPE. A lot of debate about face coverings. The general thinking is these might be marginally beneficial, but potentially could do more harm than good. In terms of risk assessments, I mentioned that there is a requirement for employers to carry out a risk assessment. If the employer's got more than 5 employees, it must be written down, and very strong guidance around engaging with workers and trade unions, just to get the engagement and buy-in, because it's really important that staff at this time do buy in, because you can't implement these measures without the support of the staff. And there's an obligation to record and publish significant findings to the workforce as well. The Health and Safety Executive expects employers with more than 50 employees to publish on their own website. Again, going back to the gov.uk website and also on the HSE's website, there are example risk assessments that you can download and also templates you can download. So I'm sure you've all got experience of doing those. If you haven't and you want some guidance, just go to the HSE website. And in terms of the sector-specific guidance, so the government's produced guidance on 8 specific sectors, which is again available on the gov.uk website. So construction and outdoor work, factories, plants and warehouses, labs and research facilities, offices and contract centres, other people's homes, so for instance in a caring context, restaurants offering takeaway or delivery, shops and branches and vehicles. And if you haven't seen that, I would urge you strongly to look at the sector-specific guidance. And there's a very clear message that if your business involves multiple of those sectors, then you'll look at each of those as required. There's also webinars that BEIS have recorded with the Health and Safety Executive on there to review each of those and provide specific guidance and answer some Q&As. Those are all available on the gov.uk website, and I urge you to look at those. The other key point to make is the situation is ever changing, so the guidance changes as the science changes. So the experts are always playing catch up in terms of trying to see where the science is going. So that's all the general stuff. What are we doing? Initially, our key focus was around supporting clinicians returning to work. So we, as part of our business model in our occupational health business, we provide clinicians on site at customer premises. So that has a specific challenge because we don't control those premises. It's not a landlord that we can go and we have a contract with. These are us providing people on our customers' sites. So we've created a specific risk assessment for that process, again, working with the people doing the tasks. So looking at things like socially distanced appointments and standing appointments as well. So obviously minimising the amount of contact time. So we've provided our clinicians with vinyl floor markers that they can take with them at the start and the end of each day and move from workplace to workplace. As generally speaking, this work's done peripatetically, so work can be done at different customer sites on different days. We've taken away chairs, and we're only using chairs if there's a clinical need to do so, and again, enforcing wipe down of chairs after that. Posters on the consulting room doors, so if someone presents with symptoms, we ask them not to go in and talk to our clinicians, but instead to follow site-specific procedures around either returning to home or a specific area. Guidance on PPE, and there is some fleeting contact in our clinical processes, for instance, for temperature taking that would require PPE, so we're using the FFP2 2 masks for that. And then also guidance around transport to and from the site. And again, we're telling our staff, we're advising them strongly not to cohabit a vehicle when travelling to site, not to use public transport. What we've really done is work proactively, both with our own staff, but also with the customers. So we're basically saying, well, this is our risk assessment. This is what you need to be able to provide on site for our clinicians to come on site and provide services to your employees. So looking at their risk assessments as well and seeing how they dovetail together. And in communication is really important in this case. So we provided a pack to our occupational health team that consisted of the risk assessment itself, letters to customers that we send in advance of coming back onto site to say these are the things that you need to have in place, guidance for our own clinicians and a checklist of all the things that they must do when they arrive on site. And that's gone down really, really well. And it's important for us to make sure that we're giving our staff the support they need. In terms of our own consulting, we have our own premises in central Birmingham, just above, very close to Snow Hill Station, and other places around the country. Similar measures to us providing clinicians on site. The key difference here is we are working actively with the landlord to make sure that we're taking account of people traversing common areas. So we're on the 5th floor of a building that's a shared occupancy. So how do we factor in our customers getting up to our consulting rooms and looking at touch points around lifts, reception areas and so forth. So a slight difference with us providing clinicians on site. Looking at our own staff and our own offices, we've been really, really lucky in that 99% of the things we can do, we can work from home, and we've done so very successfully. We have a very, very small skeleton presence in site. I'm on site today. There's about 3 of us here in a building that seats about 150, and that's just for essential things, really. We've created a baseline risk assessment that we did when initially all of the lockdown happened, and we're now in the process of tailoring that with specific measures, again, using the BEIS guidance. So looking at things like desk positioning, cleaning, sanitisation, and all the stuff you get from the government guidance. Again, stressing the importance of staff communication. We're not a unionised employer, but we do have a staff forum. So again, we've engaged with our staff forum in terms of getting representatives from each part of our business, and that could even go down to individual floors in the building because they know how they work, and getting them to buy into the creation of our risk assessment and also to communicate with our colleagues. And we've taken a fairly hard line in terms of people coming into the office because there's a spectrum of people, as Phil was saying, that don't want to come in, and there's people that are desperate to come in because social interaction at work is a big part of their job, or what they get in terms of enjoyment from their job. At the moment, we're taking a fairly hardline view and following the government guidance, which is saying you can work from home and therefore you should work from home. So only in exceptional circumstances are we allowing people in, and again, looking at the measures we have in place. Finally, I think a topic that's going to be of real interest to lots of businesses is home working. This is very much the future, we think, and we're embracing home working as part of our long-term strategy. Obviously, we had to do a lot of that now in terms of our COVID response, but we see that as really important for us going forward. And we've made some strategic decisions around property with that in mind. In terms of making sure that we are looking after our staff, initially when lockdown happened, we started with a basic DSE assessment. We put in place some guidelines to either allow staff to buy their own peripherals, so keyboards, mice and so forth, and claim it back via expenses, or to come safely into the office just for the purposes of collecting things and departing immediately. And that's gone down really well. And looking at the minimum requirements under DSE regs about being able to raise the laptop screen so that your posture is supported at a desk. So the laptop must be in line with the top of the screen, must be in line with your eye level as you're seated. Now that we see home working becoming part of our long-term strategy, and as I said before, many companies are, we're focusing on much wider home working risk assessments, which are a lot more holistic than just looking at DSE. So we're starting to look at things like trip hazards in the home, PAT testing, provision of fire extinguishers, first aid kits, and so forth. We're very fortunate we have an embedded physiotherapy partnership with Sun Rehabilitation, who provide services on our behalf to our customers. And we're now starting to look at how we provide kit for our own staff. Differences around the height of office tables, so versus desk tables, office tables versus dining tables. It wouldn't be reasonably practicable for us to provide tables and desks for employees, but the area we're really focusing on is on chairs, making sure that we can provide appropriately adjustable chairs. So again, working with Sun Rehabilitation in terms of suitable kit. And our approach is there's no point buying a £100 chair that probably won't last too long if you can buy a chair that's maybe slightly more expensive that has longevity in terms of use and it has all of the adjustments that need to be made under DSE regs. So adjustable in height, stable with a five-star base, and adjustable lumbar support. So we're really keen on that, and we're now starting to do individual assessments with our own staff on that front. There are some nuances around home working. So, for instance, the provision of arms is not required on a chair, and actually stowability at home, because people have potentially limited space in their home environment, getting them a suitably adjustable chair that can actually be stowed under a kitchen table or a home office so that it doesn't become a trip hazard is quite important as well. And really, the other thing I wanted to stress, and Phil's already mentioned this with our RISE product, there's very clear guidance from the HSE about stressing the mental well-being of staff, and we're fortunate as an employee health and well-being company to be able to offer those sorts of products, and that's very much in line with the ACAS guidance on that front as well. And as well as our RISE product that Phil's mentioned, which forms part of employee assistance remotely, we also have wellbeing champions, we have a mental health forum, we use a collaboration tool called Slack, and our wellbeing champions run daily competitions on Slack, and some of these are fun things just to keep us all interested and really making sure that we are doing everything we can to help our employees, especially those that are maybe working from home and don't cohabit with anybody, just to combat the kind of loneliness aspects of that. So we're trying to take our responsibilities really, really seriously in that area. And that's all I have to say. So, Henrietta, I'll hand back to you, if that's okay.
Thank you very much. And Phil, if you'd like to unlock your camera and mic again to rejoin us. We've only got a very few minutes for questions, I'm afraid. It's amazing how quick time can go. But Grace is going to open up the question function on the chat. We've had a couple already, one of which we've answered in the chat. But he had one from on government guidance that the moment, of course, is work from home if you can. Do we imagine this is going to change anytime soon? When it does, is this going to be a change back to go to the office? or do you think it would probably be more of that sort of phased past returns?
Well,
Phil, do you want to tackle that one?
Yeah, thanks, Ed. Henrietta, I think the working from home, because as Adrian pointed out, referenced the way we hope to secure a safe workplace, the principles of social distancing are really key. And if you're going to socially distance a workplace, you've got to limit the number of workers in that workplace. So therefore, I honestly believe that working from home is going to be the mantra for the foreseeable future. I know quite a lot of large organizations are not really considering a significant return to the office until the early part of 2021. And that I think this is part of the new norm. I mentioned in the early part of my talk, there's a suggestion around a 60-40 rule, where a lot of employers are thinking we'll let employees work 3 days a week from home, 2 days in the office, so they get the blend of home and work. They get the social interaction of coming to work with their colleagues, but it means we're only going to have 40% of our employees in the building at any one point in time, which means that we can socially distance more effectively. So I really don't see a government announcement that it's okay to no longer work from home. I think, would you agree with that, Ed?
Yeah, very much so, Phil. I think the government's taking a cautious approach, and if you look at multiple objectives and all the things that the government is juggling, obviously they're trying to open up the economy stage by stage, phase by phase, so that money is circulating around and the economic impact is minimised. And I think very much the guidance will be phased, and until the science changes, one of your key defences is to work from home. We're really fortunate these days in that the technology really supports it. I shudder to think 20 years ago we just wouldn't have been able to do all this, whereas certainly for nearly all of our staff, apart from our clinicians and a lot of the companies I talk to, they can work from home and are doing so successfully from a technology point of view. The challenge comes, I think, with certainly those companies that can't do that, and see deep sympathy for hospitality trade and so forth. But those companies that want to look at the well-being of their employees and the social interaction they get from the work environment, so the desire to be in rather than the fact that they have to be home.
Brilliant. I'm conscious that we're very short on time, so I'm going to combine two quick fire questions here. Grace, we've answered that question in the chat box, so that one's been covered. My other two questions then are, so working from home, it was something that a lot of employers had to do in quite a rush, setting up everyone to work from home. In your experience, are we doing it properly? Are there things that employers should be aware of in terms of making sure people are working from home safely that perhaps you don't think they are at the moment? And then my second question, to combine a totally different one, Phil, you mentioned early on that you'd had experience of some employers finding some employees were ignoring social distancing guidance in the workplace. What advice do you have for employers who might find that some of their employees aren't following the rules? What can they do? So two totally different questions. Good luck.
So, well, Phil, shall I tackle the first and you the second, Phil?
Yes.
Okay, cool. So in terms of home working, yeah, I think it's difficult to know what goes on in people's houses, isn't it? But I think most companies will have reacted in the way that we did, which is get everyone working from home as quickly as possible, get the technology working, make sure everyone's got access to the systems they need, and give the kind of basic advice in terms of laptop risers and peripherals and things like that. And I think on the whole, I'm not seeing a lot of instances where that's not being done well. And I think the fact that users can quite easily go and purchase those things themselves, I'm not getting a massive sense of risk in that area. Where I think the challenge comes is now this is going to be more of a protracted thing, is moving to the next phase of it. And I think that's where companies will need to make serious investments. So think, for instance, providing chairs at home for people. It's a £200-300 investment on an individual chair, as well as all the other things, and looking at the distinction between a DSE specific assessment and a home working assessment. So I mentioned the sorts of things we're starting now to look at around trailing cables, PAT testing, first aid kits in the house, fire extinguishers in the house. I'm not saying all of those things are necessary, by the way. It's the sort of things we are looking at the moment. So for me, it's moving into that next phase of how do you get from DSE to home working risk assessment.
And very quickly, Henrietta, if I come in on the second part of the question, I think I refer to the Police Service of Northern Ireland, who very successfully maintained compliance during the lockdown with their principles of engage, educate and enforce. And that was very successful, discussing it with the people, educating about the reasons for this, and then only if non-compliance was clearly evident, then enforcing. So I think that's a good mnemonic for employers to take away: engage, educate and enforce, to ensure that social distancing is maintained. Of course, one final comment: if the researchers at Oxford who are leading the chase for a vaccine are successful and it works, well, this time next year we'll probably have a very different webinar.
We will indeed. It'd be a game changer getting a proper vaccine through, wouldn't it? Right, well, thank you very much, everyone. That's all we have time for today. Thank you for joining us. To bring to your attention, we have a few more webinars coming up that may be of interest given the topic today. So maintaining self-confidence in challenging times, looking more at you personally and your own well-being throughout this challenging situation on the 9th of June. We've got employee well-being and the return to work, so picking up on more of those messages already raised, some of the things that you're addressing with BHSF Rise, looking at those well-being aspects for people who are coming back into the workplace after plenty of time away, which is on the 10th of June. And then finally, local supply chain in a COVID-19 world. This is a slightly different take on the subject. We're going to be hearing from St Joseph and how they're engaging local businesses and those opportunities that exist for local businesses to do business as part of their supply chain within the St Joseph Group. So that's all from me. Thank you again to Phil and Adrian for your time and expertise this morning, and I hope that you'll all be joining us on future webinars.
Thank you.